This data shows that 2,000 children were born in Washington state thanks to IVF. That's what's at stake. The ability to build families, the future of countless individuals who dream of becoming parents. The Seymours, a couple from Renton, took their chance, and now they have a son.
Say hi.
He's an amazing little guy.
Every new development little Kepler has is what his mom and dad prayed for.
I always wanted to have a family.
Sitting here with his 10-month-old son, Kepler, and his wife, Jessica, seemed somewhat impossible 16 years ago for Randall.
That it showed up on my rib cage on the outside.
The mass on his rib cage turned out to be Ewing sarcoma, a type of bone cancer affecting children and young adults, according to Johns Hopkins.
My dad was smart enough at the time to question, does that mean he's going to be sterile? Because semen's also a fast-growing cell. And the doctors went, well, during chemo, most likely.
Since he's been paying for sperm cryopreservation, he froze his sperm knowing one day he and his wife would need to choose a fertility treatment if they wanted to have biological children. Randall married Jessica in 2018. The two discussed IVF, in vitro fertilization, to build the family they both dreamed of.
I loved him before he was even growing in my belly.
The pair trusted science, but had no idea what they were in for.
Okay, yeah, let's do that. I mean, it's going to be hard.
Little did they know they were part of the 1 in 6. As of 2023, 17.5% of adults worldwide face infertility, according to the World Health Organization. In Washington state alone, over 200,000 people are affected, says the State Department of Health. Reality hit the Renton couple hard. IVF would cost them $20,000 per round, quite the price tag.
I've been told throughout my adult life by multiple people that God made me sterile because he didn't want me to have kids.
Not to mention the shift in society. Conversations about IVF became increasingly heated and turned into broader debates over pro-life and pro-choice ideologies in the U.S.
It's hard to watch.
Politicians threaten to restrict treatments as so-called fetal personhood bills have been passed in more than a dozen other states.
That's terrifying. That shouldn't ever be happening in our country, but that's where we're at.
And while Trump has said he will let states decide the issue, Senator Maria Cantwell has emerged as a steadfast advocate for protecting access to IVF.
This nonsense has to stop. This is about families planning. This is about families planning for their future.
A future the Seymour secured overseas at a fraction of the price. Medical Director Dr. Juliet Skinner with the Barbados Fertility Centre has been treating U.S. couples for over a decade, largely driven by cost.
Look, we continue to see year-on-year growth from inquiries and patients seeking help and us providing patient care to patients from the U.S. But if policies change and that becomes more restricted, that will only increase further.
I knew it was going to hopefully accumulate to a baby.
The promise of a new life, the culmination of all their love, faith, persistence, and IVF.
Oh my God, it's there!
The pain, the uncertainty, the endless doctor visits and injections, suddenly, it all faded.
You can see the realization in her eyes that she's fighting for something real.
The Seymours are making it their personal mission to raise awareness about what's at stake. They're stepping up on behalf of everyone who dreams of becoming a parent but is faced with challenges of infertility.
It's not so much about what we're fighting against, it's about who we're fighting for.
The Seymours still have 4 fertilized embryos in Barbados ready to help them expand their family when the time comes. Though their IVF journey began long before reproductive laws were even on the table, they urge other families to do their own research. Now, for them, their son Kepler isn't just a blessing. He's a powerful reminder of why protecting access to IVF in the U.S. is essential for every family's future. Alejandra Guzman, Fox 13 News.